Signal management. Welcome to our session on signal management in pharmacovigilance. In this presentation, we are going to explore the entire process of signal management, from detection to closing a signal. Signal management is crucial for identifying safety concerns related to medicinal products and taking appropriate actions to ensure patient safety. Throughout this presentation, you will learn about different stages of signal management, the sources of signals, the validation process, and the regulatory framework that governs these activities. Disclaimer. Before we dive in, let's address the disclaimer. The content in this slide is copyrighted by NextPV Services and represents the views of the creator. The NextPV expert team uses artificial intelligence to enhance operations, but human oversight ensures accuracy and integrity. The disclaimer is a reminder that while AI plays a role in creating high-quality content, the human team is responsible for maintaining relevancy and accuracy. These AI-generated scripts show how technology is playing a role in delivering high-quality, accurate content, with humans guiding it to ensure relevance and integrity. Content. Here's what we are covering today. This presentation includes abbreviations, a definition of signals, the signal management process, signal detection, signal validation, signal analysis, and recommendation for action. We will also discuss the exchange of information and the legal background for signal management. This comprehensive agenda ensures you will have a clear understanding of the signal management process and its role in pharmacovigilance. Abbreviations. Let's start by looking at some of the key abbreviations used in this presentation. Terms like AE, adverse event, CA, competent authority, ICSR, individual case report, and RMP, risk management plan, are critical to understanding signal management. This list of abbreviations will help you follow along as we discuss the various elements of signal management and the associated regulatory requirements. Knowing these terms will make it easier to navigate the rest of the presentation. Signal management process. Here's an overview of the signal management process. It starts with signal detection, followed by signal validation, analysis, and prioritization. The process continues with signal assessment, recommendations for action, and the final step of closing a signal. Throughout this process, there's an exchange of information and communication among stakeholders. The Signal Management Team, SMT, plays a central role in coordinating these activities and ensuring that signals are managed effectively and in compliance with regulatory requirements. Signal detection. Signal detection involves identifying potential signals from various sources. These sources include individual case reports, suspected unexpected serious adverse reactions, adverse events, and serious adverse events in the safety database. Other sources of signals include risk management plans, aggregate data, and medical and scientific literature. Regulatory authorities like Pharmacovigilance Risk Assessment Committee, PRAC, and EudraVigilance Data Analysis System, EVDAS, also play a role in signal detection. Effective signal detection is the first step in identifying potential safety concerns. Signal validation. Signal validation is the process of evaluating the data supporting a detected signal to verify that it contains sufficient evidence to justify further analysis. This step involves assessing the clinical relevance, quality of the source data, and the strength of evidence for causal effect. The outcome of signal validation can lead to further analysis, monitoring, or closing the signal if there is not enough evidence. Validation is a critical step because it helps ensure that only valid signals proceed to the analysis and assessment stages. Signal analysis and prioritization post-assessment. Once a signal is validated, it's analyzed to determine its significance and whether it requires urgent attention. Signals with a significant public health impact or those that may affect the benefit-risk profile of a medicinal product are prioritized. The signal management team discusses validated signals and decides on their priority. The objective of signal assessment is to evaluate validated signal and determine if additional data collection or regulatory action is needed. The outcome of this assessment is summarized in Signal Evaluation Report, which guides the next step in the signal management process. Recommendation for action. Signal assessment leads to recommendation for action. These recommendations can range from no further action to various regulatory measures. Safety signals that may require action include major safety issues identified in clinical trials, new unlabeled adverse events, or drug-drug interactions. Depending on the severity of the signals, recommendations may involve updating the summary of product characteristics, creating or updating risk management plans, or issuing direct healthcare professional communications. These recommendations guide how to address safety signals and ensure patient safety. Continuing from the previous slide, let's discuss other possible recommendations for action. Some signals might require further evaluation, monitoring of the safety issue, or obtaining additional advice. Other actions could include updating product labels, notifying competent authorities, or taking urgent safety restrictions. The recommendation depends on the outcome of the signal assessment and the potential impact on patient safety. These recommendations ensure that pharmacovigilance activities address safety concerns appropriately and in a timely manner. Closing a signal and exchange of information. Closing a signal involves determining whether no action is required, the issue has been solved, or follow-up information refutes the signal. Closing a signal also happens when client is no longer responsible for signal detection for a particular product. This step is important for tracking the status of signals and ensuring that no unresolved signals remain. The exchange of information is crucial in the signal management process, especially for signals that have implications for public health. Communication with the competent authorities and the public ensures transparency and timely action on safety concerns. Legal background. On this slide, you can see legal background for signal management. It references Good Vigilant Practice, GVP Module 9, which covers signal management in pharmacovigilance. The legal framework guides the entire signal management process, outlining the requirements for detection, validation, analysis, assessment, and recommendations for action. Understanding these legal requirements is essential for compliance and ensuring that signal management activities are carried out in accordance with regulatory standards. Thank you for your attention, and thank you for staying with us throughout this presentation. If you have any questions or need more information, do not hesitate to contact NextBV. We are here to help and support you in all things pharmacovigilance. Remember, our commitment is not just to complete tasks, but to ensure your satisfaction and patient safety. And we look hearing from you.